Thank you, Dr. Angita and Sahani sir. Good evening, good afternoon, and good morning. This is the 1431st day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this webinar session. And today, our guest is Dr. Suraj Singh Bhadoria. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy was formed by a group of homeopathic lovers and students and homeopathic doctors. And we have 3 sessions every day, and from today onwards, we have a change in our schedule. Our Hindi session will be at 7:30 to 8:30, and from 8:30 to 9:30, we have the international session in English, and 9:30 to 10:30, the local language session in Malayalam. So all these sessions are going in a good way, and we are uploading almost every videos on the very next day itself, so that you can watch again and again, and you can share and you can subscribe. At YouTube, the name, when you type IFPH homeopathy, you can find our previous videos also. And as you all know, that today we have a guest in Dr. Suraj Singh Bhadoria, and the doctor has completed his MD, and then is doing PhD now. That is why it is written as PhD scholar, and he has presented so many beautiful sessions on research in this forum. And all the presentations were really excellent. It is the time to prove the world that homeopathic doctors are also doing research work. So that means that this is also a scientific system, and this is the best scientific system in the world, because we are having a lot of things to prove to the world, and thereby the people are the beneficiaries here. And Dr. Suraj Singh Bhadoria is working as an assistant professor, Department of Homeopathic Pharmacy at Institute of Homeopathy and Research, Paul University, Vadodara, Gujarat. And all the presentations are really excellent. Today, Doctor will be talking about animal study in homeopathy. That is a different subject. Let us see what Dr. Suraj Singh Bhadoria has to say. We proudly welcome you, Doctor.
First of all, again, I am very glad to share my experiences with in this platform, international platform. So today we started with this animal experimentation in general. Then we will come to know what is the utility of this experimentation in our pathy. Is it visible, sir?
It's visible, but you have not yet shared your screen. Please
Wait,
read.
sir.
Yes, we all know that there are a lot of research work is going on under the National Homeopathic Council, and we have a lot of research centers, that is Central Council of Homeopathic Research. All these clinics, all this area where we have a lot of patients in our homeopathic clinic. There is one research center at Kottayam in Kerala, which is always full of patients. All the OPDs are, every day the OPDs are filled by pre-booking, and there is no uh, appointment all of a sudden. There is some technique network problem with the Dr. Suraj Singh Bhadoria, and that's the reason why he went out without sharing. That's the reason why he was not able to share the screen. Otherwise, always he was a person I fully dedicated to our Zoom sessions. We can just wait for some more time. Is about to join. If anybody want to talk on this kind of proving, you can raise your hand so that we can have a talk on that. Uh, as you all know, the International Forum for Promoting Homeopathy has done such a great job in doing such kind of webinars, and all the half of our webinars were uploaded in the YouTube now. What you have to do is you just subscribe it and share with your friends and and not only with homeopathic doctors, of course, you can share it with your friends also, because there are a lot of things for common people also in our sessions. They can understand what is happening with the homeopathy at the present situation, and what are the things we are doing for homeopathy also. So I think we are on the right track, and uh, there are a lot of issues coming day by day, and we were able to coordinate our doctors in India as well as internationally, so that they can also know what is happening in India. As you know that India is the place where homeopathy is just like booming like anything. It is growing like anything. And this kind of growth, that's the reason why homeopathy is the second largest system practicing now. Yes, our guest is this has joined. Let us wait. Within a few seconds, we can go ahead with the. Yes, I can make it Dr. Co-host. Yes, yes, Dr. Suraj Singh has joined, and the session will commence without any problem. Yes, doctor. I can unmute yourself. Yes. Your audio is connecting now. Please. Yes, now it is connected. You can unmute yourself and present.
Am
Okay.
I audible,
Yes,
sir?
yes, you're audible, and I can.
Okay. Now I am going to present my PPT again, sir. Sorry for this connectivity, sir.
No problem. It is technical problem. It is not your defect. Okay.
Is it visible, sir?
Yes.
Okay.
Yes.
Okay. Now, what are animal experimentation? So basically, the animals, they are tested in that scientific experiments or tested in a live, or which undergoes into that particular suffering, pain, distress, and some other pathological conditions. So the animal experimentation, generally it is regarding with the experimentation on the animals for that particular disease condition, for that particular abnormal, or what we can say, the deviation in their physiology, so that we can know about the testing or the trial of our drug or the medicinal substances. So animal experiments are not just like to take or to have a animal in a cage and just you are going to trial your drug in that particular time interval. It is generally the trial, and it is a process to know the pharmacological action of our drug substance, of our medicinal substance in that particular living entity. So this is a preclinical trial. Generally, there are different phases of trials: preclinical, clinical. So in the preclinical trial, we generally consider this animal study for detecting, for knowing the pharmacological action, efficacy of medicine, efficacy of drug substance, and toxicological analysis also. So it is the animal experimentation. Generally, animals are used for the various laboratories, for the various purpose, for the different type of experimentation, for the preclinical trial, for detecting the toxicity of our drug material, toxicity of medicinal product, and some other pathological or the disease condition. So these are the animal experimentations. Now moving towards the next part, that is regarding with the animal experimentation inclusivity. So generally they are forced for feeding with the potential harmful substances. It means we are going to inject the harmful or the toxic substances in their body. This is our first criteria. The second one is the surgical removal of any particular organ or the tissue for the in vitro study. In some time, what we can do, we have to trial our medicine or the drug substance in their body, and afterward we go for the biopsy and the study of that morphological structure of that particular cell and that particular tissue and the organ. So we are going to remove that cell, that tissue, that organ from their body and study that cell and the tissue under the microscope. So this is another aspect for the animal experimentation. First is to feed and to give them a toxic substance. Second is to remove their tissue and the cell for a particular microscopic study, the morphological study, the in vitro study from that in vivo or in vivo study. The third one is to forcing the animal for inhaling the toxic gases. What are the reactions? What are the morphological and what are the pharmacological effects in their body after inhaling that particular gases? And the last one is to subjecting the animals for frightening situation to create the anxiety, depression, and some other mental type of and some other symptoms related to CNS. So these are the main objective and the subjective of this animal experimentation for this type of research work. So before going to the homeopathy, first we have to understand what is the animal experimentation, what is the need of that type of experimentation, what is the utility of that experimentation, and what are the main objectives of doing that type of experimentation. So I think this is a very needful for us. Why we do animal experimentation? In our homeopathy, we talk about the symptomatology, we talk about the healthy human provings. But what is the use and the utility of animal experimentation or such type of preclinical trials in the homeopathy? So that we can know. Next one is just to study this part. Next slide is regarding with the utility and furthermore objective of this experiments. Why we do animal study? So some experiments require the animal to die as a part of test. For example, if there is a regulatory test for Botox or the vaccines, so some of the tests for the chemical safety, they are using a certain variations in that particular dose, and they are generally around 50% of the animals died or they are killed just before the point of death. So these are generally related to the trials of vaccines, their toxicological analysis in that particular species. Either it may be the rat, the rabbit, or some other animals. So these are the in general experimentation and the main goal and the objective for doing animal or preclinical trial. So generally when we talk about the vaccine, it is very major part. There are so many aspects and there are so many factors are involving in the this regulatory and the trial of the vaccination. So generally we do the nucleic acid and the utilization of their protein part in the prover or in the living entity to showing their pharmacological action on different system, on different cellular event, on different tissues of the living entity. So this is in general objectives and in general the aim of doing such type of trials, which is preclinical trial, because it is before the human experimentation. Moving towards which type of animal has been used. So generally there are wide range. There are a large range of animal species which are generally regularly used for this type of experimentation. When we talk about the vertebrates, so the mammalians, the birds, fish, amphibians, such type of what we can say the animal groups are may be the considering, or they may be the part of this type of experimentation. But invertebrates like octopus, which is defined as animal by the European legislation government animal experimentations, they are just going to involve in that particular trials in that particular research area. But in the USA, the rat and the mice, fish, amphibians, birds are not defined as animals. So generally, this type of variations and this type of, what we can say, the differentiation in the animal, in the type of animal, in the species of that animal may differ from the country to country. So generally, the USA, according to this, the rat and the mice and the fish and the amphibians, birds, these are not as per the animal experimentation as per their rules and regulation. So that means no legal permission to experiment on them and to have or to show any type of statistics. So this is in general historical, what we can say, the part of this animal experimentation as per the USA guidelines. On other hand, the animals used in experimentations are usually the breed for this purpose. Breeding facilities should be there. So it should like, if it is a multi-million dollar industry, so it is just like to have that kind of facilities for animals. When we believe that all animals are equally important, a dog breed for research is still a dog who could not otherwise live a happy life in a loving. So generally, there are different species, there are different variations, there are different aspects, there are different rules and regulation of different areas, of different zones, or different countries to have and to run such type of trials, which is preclinical, and to maintain that forum, to maintain that experimentation, that type of research work in a right propagation. Some of the monkeys are still trapped in the wild or in the African area, in Asia and the South America, which has been used for the experimentations for some other breeding facilities. So these are in general, these are in relation to the experimentation. So when we have that particular species from that particular area, from that particular place, so we go for the experimentation on that species only. So this is just like that. But before going to that particular trial, we should follow the rules and regulations which are governed by that particular country, that particular zone. Because if we are not going to have that facilities and that type of rules and regulations, so it is against the ethics, it crosses the ethical boundary. So it is not your research work, it is just to play with your animals in a toxicological ground. So it should not be happen. We have to follow all the rules and regulation, the different guidelines for the animal experimentation. On other hand, the horses and some other animals like cows, sheep, pigs, they are oftenly supplied by the dealers, and they may originated by the racing stables or the farmer in the use of animal experimentation. So we can also do that type of experimentation on that particular species of animal also. But commonly it includes the mice, fish, rats, rabbits, guinea pigs, the hamsters, the farm animals, birds, cats, dog, mini pigs, are non-human primates, monkeys. So these are chimpanzees. So these are as per a different zone, a different countries. So these are a different species. So you can know if animal, depending on, or if animal chosen for on the basis of the different species, so they have a different genetic orientation, a different nucleic acid or the peptide bond. So when we prove our drug or the medicinal product over that particular part, so they may have a different orientation in the deviation of their physiological aspect. When we prove any drug, when we administer any toxic substance, any medicinal product, any drug substance in the living body via any route, So they are going to change their peptide, the nucleic acid, the DNA, the RNA, the genetic makeup on that particular drug material on the basis of their nature. So this is the pharmacological action. This may vary as per this different species. So that's why we cannot say that experimentation on animals, they are just same as the human experimentation. You may have the different sign and symptoms while proving on human with the same drug, with the same potency, with the same geographical area also. So you may have these differences. So it is maybe because of that changes and having a different genetic makeup and the nucleotides and all this biomolecular structural analysis. So this may give you the differential or some other variation in the drug proving. Now, what about the animal experimentation in the laboratories? What are the in general orientation for laboratories? So generally, like, laboratories are no place for any type of animal. They are typically sterile indoor environments in which the animals are forced in a cage or pen or the boxes where they are completely freedom of their mobility, their movement. They cannot be restricted. They should move. They should have that normal, healthy lifestyle, so that when we control over their lives, so the animals in the laboratories are confined on their own and without the companionship of others. That's why animals should not be trial in a particular laboratory or such places where they are restricted. The places should be free. They are just like a healthy environment. They have a proper space for motion, for their movement. So this type of spaces were used for such type of research work, for such type of experimentation. Our investigation shows that from time to time, there are certain animal research community, or what we can say the life inside the laboratory. They may vary as per a different condition, as per a different time duration. So they are not like a fixed. They may have a different variations. So on selection of some common animal procedure, what are the procedure we are going to perform or generally be used in animal experimentation? So generally they are forced for chemical exposure in the toxicity analysis. When we go for toxicological analysis or the study for the toxicity regarding to that particular drug or the medicinal product, so we go for this type of analysis. We go to expose that particular toxic material in their body, and that can be taken by oral, or that can be inhaled also, or via skin, or the injection into the abdominal muscle, intraperitoneum. So it is in general various routes for administering the drug material or the toxic substances in their body. So the first most important procedure is the toxicity testing. The second one is to expose to that particular drug or chemical or infectious disease to cause illness like a pain, any distress, or the death. So this is the chemical analysis or the infectious analysis. So you may have the fungus, you may have any type of bacteria, either gram positive, gram negative, E. coli, Staphylococci, Streptococci. So you may go for that type of analysis, the pathological intervention in that particular species for any particular disease condition. You may create a pain, you may develop a certain fungal infection, you may develop a certain bacterial infection in that particular living entity, so that you can know about the efficacy of your drug material towards antibacterial, antiseptic, antifungal, antiviral, like that. The third one is the genetic manipulation. You may have a certain, what we can say, the knocking out the gene mutations. So you can also develop that type of experimentation in animals. So you may, because there are certain drug material or the medicinal substances which are acting on the DNA or the RNA on that particular gene. So you may have that particular orientation also. The another one is the ear notching and the tail clipping for identification. So you can also go through that. It is very simple and it is not like too much of difficult and very vast experimentation. You may also develop this type of objective in your procedure. The short period of physical restraint for observation or experimentation or examination. On other hand, the prolonged period of physical restraint, food and water deprivation, surgical procedure followed by recovery. So these all are the in general procedure which are used while doing the animal experimentation or the research work in the animals. So these are in general procedures for any type of animal or the preclinical study. Next one is infliction of the wounds and the burns and some other injuries to study the healing of that particular living entity. Suppose if your medicine, like in our homeopathy, we have so many medicines like Arnica, Hypericum, Thuja, Ledampal, and Rustox, Ruta. These all are acting on the wounds. So you may also create a wound in the healthy rat, in the healthy species, in the healthy species of animal. So first you have to select the species, they should be healthy, then you can create a injury or the wound in that particular species. Then you can go for the trial of your medicine which is acting well on the wound, on different types of wound. Then while doing this type of experimentation, you can know about the efficacy of your medicine in the healing of wound. So you may also go for this type of procedure. Infliction of a pain to study its physiology and the treatment. Generally we also have a certain painkillers like hypericum, like Macphos. So these are generally acting on the nerves. These are generally given for the condition of neuralgia, which is pain. So generally for that type of study, we also go for the pain study, or what we can say, the animal experimentation, which is conflict by the pain. So you can also create two different groups, a medicine group, control group. The medicine group, which is going to have this what we can say, the pain, the damage to that particular nerve branch, and afterward we go for the proving of your medicine on that particular nerve. So this is just like a animal experimentation with regarding or inclusivity of the pain in their physiology or in their treatment part. So you can have the comparison in the control group or in the medicine group. Another one is your behavioral experiments. There are certain disease condition, or what we can say, the electric shock, the pore swim test. So generally it detects or it reflects the CNS disorders, or what we can say, the symptoms regarding with the functioning of or physiology of CNS. So if there is any depression, anxiety, or what we can say, the stress, so for that type of experimentation, you can go for the behavioral study of that particular living body or that particular living entity. So you can go through that. So while doing this type of experimentation, you can develop that particular orientation in the animal body. The other manipulation to create animal models of the human diseases ranging from cancer to stroke to depression. So these are a wide range of pathological or disease condition in the animal model. So you may have the cancer, you may have the stroke to depression. So these are the different variations. Generally in cancer, there is more morphological changes in the cell and the tissue. In that particular organ, there is a different variation. In the stroke and the depression, generally depression, it is the functional. Okay, and in the stroke, generally there is a deficiency of oxygen on the CNS, on the brain. So these are the different variation. So because of that deficiency, because of that lack of blood supply, infarction, ischemia, the part of brain going, the size of brain is going to decrease down. So there may be some physiological as well as the morphological changes in the stroke. So these are all pathological or the physiological orientation which can be studied in the animal models. So before going to any type of clinical or the human trial, we should have that type of orientation. Generally in our homeopathy, we are talking about symptomatology, we are talking about the healthy human provers, we are talking about the repertorization, but there should be a inclusivity of animal experimentation in our pathy also, because animal experimentation will give you a brief idea about the toxicity, about the dosage, about the various model and various aspect of the drug proving or the medicinal trial. So you can also have that particular knowledge, you can also have that particular skills, you can also have that particular evaluation in the animal study. So definitely we should have that design, we should go through that, so you can have more and more better and more effective results by killing with the carbon dioxide or asphyxia, the neck breaking, and some other means. These are in general terms and these are in general procedure which has been used for the animal experimentation. So these are in general. You may work over the systemic ground. You may work over the particular nerve or the pain study. You may work over the skin also. There are certain skin diseases also like wart, corn, fungal, eczema, psoriasis. So you can also develop that skin lesion in the part of that animal model. And while developing that skin lesion and that skin disorder, you can go for the trial of your medicine which is acting well on the skin, like sulfur, like arsenic, like natrum, like ignatia, like sepia. So these are the different models. You can have that both hand in hand with the control group, with the medicinal group. So these are the various procedure which are going to perform in the animal experimentation. On other hand, animal experimentations are needed for the medical progress. Generally, it is very difficult to argue that animal experiments have been used for centuries. It is not the very recent part, and it is generally a medical progress which has been made in time to time, and animal experimentation must be necessary. It is very important part because in this experimentation you are going to analyze the toxicity of your drug material, of your medicinal product. So it is very necessary and it is very mandatory before the human trial. But this is the missing point. History is full of examples with regarding with that practices and ideas that were once considering the state of the art only to be surprised and what we can say the sophisticated or the successful story in that year or the later of this demand of this year. In the early 19th century we have this investigation or the invention of the airplane, but this is a innovation, this is a technology, and when it goes to advanced part, so it will give you a more idea and a brief idea regarding to the machinery, to the utility, to the application of that particular body. So similarly this animal experimentation needed for this research work. If we are not going to this animal experimentation and directly when we prove our medicine or the drug material on the human body or healthy provers, so generally there is missing or there is absence of toxicity, because in the human trial, in the healthy prover, there are some ethical background, there are some ethical rules and regulation. If there are some what we can say the toxicity or some deep pathological changes occur in the cell and the tissue, so we have to stop the medication. So afterward we have no complete picture or the drug picture of that particular particular drug or the medicine. So that should be needed, or that should be furnished or completed by such type of animal experimentation. And again, the scientific reviews, they demonstrate that the research which are related with the animals, generally they are correlated very poorly to real the human patients. Because generally when we talk about the data or the statistical analysis from such type of animal studies, they are failed to predict the real human outcomes. It is around 50 to 99% in certain cases, because there may be some what we can say, the no proper toxicity analysis, no proper dosage criteria, no proper morphological study of that particular cell, no proper systemic analysis. So there are a lot of things which are going to reveal, and which may have the loophole in between the animal experimentation or the in comparison of the human experimentation. So that's why the most of the studies which are already completed or done with the animal experimentation or the animal trial, they are generally may have a difference in with a human trial. So mainly there are certain species, they are generally suffered from the same disease as found in animals, but animal experimentation rely on often unique human condition being artificially induced in non-human species. So there are certain conditions which may differ from animal to human. On superficial level, you can say there may be some similar symptoms, the fundamental differences in their genetic makeup, in their physiological action, in their biochemistry, which may result in the differences in their reaction to both the illness in the animal, in the human. So this may be the cause, this may be the reason for justifying that statement that most of the studies in animal as same studies in human, they have some differences, there is no similarity. So maybe the genetic makeup, maybe the physiological understanding, maybe the biochemistry, this may all are the different aspect which may differ and have the variation in that type of experimentation. So you should know about that genetic makeup, you should know about that molecular sciences, you should know about that constitutional aspect. So this is very very important when we do animal experimentation as or in compare with the human experimentation. On other hand, the drug testing, when we talk about the drug trials, so generally we talk about the metabolic test, the toxicity analysis in acute, subacute, or the chronic toxicity, effective or the efficacy study, the pharmacological action of our drug in the living entity. Either it should be work on the CNS, either it should be work on the PNS, ANS, or the GIT, or the endocrinal system, so neuroendocrine. So these are the various system. So you have to know about the pharmacological action of that particular drug material or the medicinal product in that particular species of the animals. On other hand, we have the specific test on reproductive functions, on embryonic toxicity, because there are certain drugs which causes embryonic toxicity. So that causes fetoembryogenicity. So generally fetoembryogenicity means if a pregnant lady or a woman which have a baby inside the womb, when they are going to treat with that particular drug material, so they may have the toxicity in their embryo, in their fetus, in their baby. So this is fetoembryogenicity. On other hand, there are certain drugs which causes the carcinogenicity or the carcino, what we can say, the malignancy in their living entity, in the human body, in the animal body. So there are certain drugs which are inhibited or which are restricted for certain disease condition. So they may have that type of toxicity to produce cancer cell. So these all are related with the various trial, where various type of drug testing, why we do drug testing. So these are the main objective. When we talk about this type of orientation, when we talk about this type of analysis, so definitely we will have that type of orientation. Why we do that analysis? When we talk about the first one, the metabolic test, so what it is, generally there are certain medicines like Nux vomica, pulsatilla, China, thuja, arsenic album. So these medicines are acting on the metabolism. They are a deep acting medicine. They are not a short action. They have a very long and a deep action. So they are polycrest medicine. So generally those medicine which are polycrest, which are deep acting, so they are going to have the interference in that metabolic functioning, metabolic disorders, or like carbohydrate metabolism, fat metabolism, protein metabolism. So these are different metabolisms. So they may get affected by a different medicines. So our medicines are also going to act on that particular metabolism. Suppose thyroidinum. So it is also going to act on the metabolism in association with the hypothyroidism or hyperthyroidism. So there may be a chances of this hypo and the hyper. So this metabolic investigation plays a major role. Either your medicine are going to have the interference with that metabolism or not. Either they are going to make some changes in that particular metabolism. So these are a very important aspect while doing the animal experimentation. It is not just like to feed the animal, to go for the inhalation, to give them a toxic material and to just see the result. No, it is in general study and the analysis of the not only the drug material, we can say that the drug particle, the size of that particular molecule in their whole pathway in their animal body, in which is reaching at, up to that particular cell and tissue. So this is in general metabolic study. Generally when we talk about this metabolic study, so we have two different aspects, the pharmacokinetic and pharmacodynamic. So what is pharmacodynamic? It is action of drug on living body or living entity. So generally we go for this type of analysis. We study this. We study the action of drug on that particular cell or the organ or the system. This is pharmacodynamic. Now, what is pharmacokinetic? Pharmacokinetic is a response of body against the drug. So it involved with the absorption of drug material, distribution of drug material to various parts of the body, then metabolism, as you can see, and afterward the toxicity or the excretion part. So this is the pharmacological study. So before going to this or any type of drug or medicinal trial in animal experimentation, this is the very important aspect or the procedure to analyze the metabolic effect or the variation or the alteration in the metabolism of that species or living body. Toxicity analysis, generally there are certain drugs which causes acute toxicity, subacute toxicity, chronic toxicity. So it is as per the time duration. So we have to also analyze that on which ground, on how many intensity or which type of cell is going to have that type of toxicity. It is also the very important aspect and the very important part in the animal experimentation. On other hand, when we talk about the efficacy, so it is very important part. Suppose we have certain medicine which are acting well in the osteo and the rheumatoid arthritis, like colchicum, like rustox, arnica, ruta, ledempal. So these are the different homeopathic medicines which are having affinity on that particular system, on that particular part, on that particular organ of the body. So you can also go through that. Either the colchicum having affinity on joints, either they are acting well on the ligaments, on the muscle, on the tension. So this type of experimentations should be needed in homeopathy also. not only the human trial, because in human trial the toxicity analysis may have some this ethical issues and what we can say the boundary of rules and regulations. But when we talk about the animal experimentation, so the toxicity analysis along with all this disease condition may be the favorable condition or maybe easier part for that type of analysis. And afterward, this reproductive part, the reproductive organ, the reproductive function, it plays a major role in the human body, in the living entity, in the animal experimentation. So that type of toxicity, that type of what we can say the functional growth, the growth in the cell and the tissue, the morphological pattern, that is to be needed in that type of specific test in the animals. So the major part is the selection of drug, which drug or material is going for the animal experimentation or testing. Second part, the dosage criteria, how many doses, at how much concentration you are going for animal trial or the toxicity analysis or the metabolic analysis or the biomolecular analysis. The third part, the selection of species. Your selection of species plays a major role. It may have a very wide range for showing you the efficacy or the effectiveness of your medicine. So the selection of the species plays a major role. Another one is the number of groups. If you have more number of groups, more number of rats, mice, rabbits, so you may have a wide range of variation in your drug testing, in your medicinal trial. The another one is, after this number of groups, the type of procedure which has been used in your whole research or animal experimentation. Either you are going to show the biomolecular changes or the analysis, either you are going to show the metabolic analysis, either you are going to show the DNA or the RNA nucleotide analysis, either you are going to show a specific test on the nerve regarding to the pain, intensity of pain. So these are the different procedures. So it is also the main aspect for doing that type of animal experimentation. And the last not least, that is your statistical analysis. Generally in various animal experimentation, the selection of groups, the selection of species, the selection of drug material, everything is like a very to be correct and perfect. But when we talk about the statistical analysis, so how many samples, how many groups, so these are very needed part in the statistics in your result analysis. So this plays a major part. If there is wrong interpretation, if there is wrong collection or the sample size making in your research study, so you may have difference in their results also. So these are the various aspect and the major criteria for doing the animal experimentation. So these are in general a very superficial part regarding with the animal, what type of animal, which type of species, which place, either the laboratories are good or bad, and what are the other procedure while doing animal experimentation, what are the drug testing. So these are the in general what we can say the parameters or the factors which are needed for that type of research work. When we know about this, then you may have a proper clinical trial or the human trial or the human experimentation. Because when we know about the toxicity, when we know about that type of dosage criteria, when we know about the metabolic disorder, when we know about the physiological variation, then you may have an in general idea, 50% imaginary idea or the perception while doing the human experimentation or clinical trial. So these are very, very important. And in our homeopathy also, we should do and perform such type of experimentation. We have a lot of medicine. We have so many drugs which are going very well and which are going to alter this DNA and RNA, nucleotides, the nucleic acid. So you may have that type of orientation also. It gives you a very conclusive result and very better result for our future perspective. So this is in general discussion regarding with the animal experimentation. What are the procedure? What are the objectives? What are the some other aspect of drug testing in the animal trial? So these are our today's topic and presentation regarding with animal experimentation. And in next session or next time, we will discuss about various particular animal model for the animal experimentation, because there are different models in animal experimentation. So it is very difficult to discuss each and every model within this time interval. So in next session we will discuss about a particular animal model in our session. Thank you so much. And these are in general our references through which all these materials and all this data were collected and we presented in this presentation. Thank you so much.
Thank you, Dr. Suraj Bhadoria. It's really a very good session. You really proved that the relevance or importance of this kind of research, because we used to do, and we have heard about these animal researchers, but why it is relevant. And as you know that, as all of us know that we cannot directly go for testing anything on human body. We need permission and everything, but in this case, you can do all this thing and find things how it works. But the thing is that the mental symptoms we cannot be elicited from this. What is your opinion on that, doctor?
Sir, basically, mentals are, yes, it is very, very important in our homeopathy, in our evaluation of symptoms. But in animal experimentation, when we talk about the behavioral study, like suppose if I give you one example of pain study or the pain stress test. So in that type of study, we also analyze the what we can say, the mental or the stress or the anxiety or the intensity of that particular pain in that particular species of animal. So there are certain models which also define the behavioral and the depression or the anxiety in the same animal as compared to the human study also. So there are different models which explain that mentals also. So it is again fruitful for us.
Yes, thank you, Doctor, once again. And now I invite Dr. Masrina from Malaysia to say vote of thanks to this session. Dr. Masrina, please. Yes. Dr. Singh Bhadorja, do you want to speak? Yes, you can speak. 1 minute.
Hi. Thank you for the invitation today. I just got invited by Abdul Salam, and I'm a homeopathic doctor in Copenhagen, Denmark.
Very happy to see you. Have you ever seen our videos before?
No, I just heard about you yesterday, so I went on YouTube today and saw a few.
Yeah, so you can say the vote of thanks to Dr. Suraj Singh Bhadoria also, because this is the time to wind up the session. And the session in our local language session is about to come. So we have a lot of presentation from UK. Of course, you can also come up here with some of your presentation. You can bring some of your patients or personal history, or even case presentation, or even subject presentation, whatever maybe you can do it. Please share your number to Dr. Abdul Salam, Sri Abdul Salam sir. So he will share it with me. So you may send the, you may please say vote of thanks to Dr. Suraj Singh Bhadoria on behalf of IFPH.
Thank you very much.
Okay. Okay, Dr. Sri Abdul Salam, please say vote of thanks.
Okay, on behalf of IFPH, I would like to express my thanks and Dr. Suraj and all our guests today. Thank you. Thank you, Dr. Steen, for coming and encouraging us. You would like to present your subject next time. Okay.
Okay, didn't think about that.
Okay,
Well,
welcome.
okay, thank you.
Thank you, Sri Abdul Salam and Dr. Singh Raj. And tomorrow we will have a session from Dr. Neha Kakkar, and she will be talking about the uncommon drug picture of graphitis. That is something to be watched. Uncommon picture of graphitis. You can join the same session every day at the same link, using the same link, and we will upload the video tomorrow itself. Thank you, Dr. SURAJ SINGH BHADORIA, and those who participated in the session. See you all. Good night.